Emergency medical care in the United States started from a physician, Dr. Michael Kopus from Seattle, Washington, who was one of the most progressive thinking physicians of that time. Him and other physicians that had military experience in Korea and Vietnam, they knew that the only way to improve patient survival rates from either cardiac arrest, strokes, or major trauma was to initiate physician-level care at the scene, in the field, and while transporting the patient from there to the hospital. That's the only way you're going to make a major difference in life-saving capabilities in medical emergencies. So he started training. First they looked and thought, well, where are places we could house ambulance units that are strategically located throughout cities? Fire stations. So he got to know the Robert Swartout, the chief of Seattle, Washington, and they became friends. And both of them shared the idea that this could be a real avenue of enhancing the quality of life in the community by providing these life-saving skills through firefighters that are physician trained out there in the fire stations and making emergency responses and transporting patients. That's where it all started. It grew from there because they, just like Houston, ambulance services, there wasn't really an ambulance service. There was funeral homes that had body cars that had red lights and sirens that would respond to emergencies. Oh yeah, they would transport patients that were alive, but they'd rather the patient be dead because they could sell the family a funeral. It was more profitable. And so physicians across the country knew that something had to change. And as I said, Michael Kopus had the forethought to put this plan and develop it and actually carry it on to fruition for the country.
And you said that was early 1960s?
Early and mid-1960s.
Early and mid-1960s. So Houston had initiated its EMS service in 1971.
April 14th, 1971.
What was I mean, surely there was a planning period there before that actually happened. How far ahead were we working on it?
You had the key initiator and person who provided the biggest impetus to have an EMS service in the Houston Fire Department is today, he is Chief of Surgeon at Ben Taub Hospital, Ken Maddox. He was, because he knew about Kopus, and he was the driving force, and he knew, because of Seattle's experience of providing this EMS care through firefighters and fire stations, that was the best solution for the community. Because now you have firefighters that are, over time, became dual trained, both in firefighting and suppression techniques and strategies, and now medical and life-saving techniques and strategy. So the citizen is now getting the best for their dollar out of the Houston Fire Department employees, because every firefighter today that rides on every emergency apparatus has to be, as a minimum, an EMT, emergency medical technician. That means he can perform spinal mobilization, hemorrhage control, and every apparatus has an automated defibrillator. He can do the most important thing to somebody that's not conscious, not breathing. Put that automated defibrillator on them. It's got an assess button, activate that, and if it's a shockable rhythm, initiate the shock. That's what starts the heartbeat again. Plus, CPR, the first thing to do is start CPR. Because for anybody not conscious, not breathing, you start CPR immediately. That puts that patient in a holding pattern until advanced care with an AED, or the paramedics carry a manual defibrillator that can actually assess the heart, what area of the heart is actually having a problem and what rhythm it's in, and then from information and bystanders and that assessment from that, they can determine and today they push thrombolytics in the field, which is clot busting drugs.